Hi, everyone. Welcome to the IPPNW Global Classroom. It's great to see you all. Thank you for joining us today for the fourth module of this 10-month-long program. I really appreciate you taking the time on this Monday to join us to learn more about the humanitarian impacts of nuclear weapons, and more specifically, what one single nuclear detonation would do over a modern city. A few housekeeping notes before we get started. Um, I'm Molly McGinty. I am the program director at IPPNW Central Office, and I will moderate today's session. If you've been a part of last sessions, you are very familiar with my face and my voice, so thank you for coming back time and time again. We ask that you remain muted throughout the duration of today's session. We'll have time for Q&A at the end, so feel free to either put any questions in the chat or write them down so you don't forget. And feel free to keep your cameras on. Again, if you're not speaking, you won't be in any public recording. Remember that we come to this space to learn together, and we all have different foundational knowledge levels. So come in with respect for one another, come in with an open mind and ready to learn alongside each other. Before we get started, I want to extend my thanks to Soka Gakkai International, SGI, for making the Global Classroom possible with their generous support. If you missed the launch or the first three modules of the Global Classroom, I encourage you to watch those now. You can find those in your email, and if you have trouble finding the links, please let me know. Again, the Global Classroom is a 10-month-long virtual education program designed to prep all of you to go out into your communities or onto the international stage, ready to push back against the deadly norm of nuclear weapons. Each session will build on the last, so make sure that you don't miss one. Um, with that in mind, we're going to jump right into today's fourth official module, where we'll have an in-depth exploration of the medical community's inability to respond to any nuclear detonation. We'll have a focus on blast and burns today. So thank you again for being a part of this. I really appreciate it, and I'm excited to see what we can do together. So today we're lucky to be joined by a leading physician disarmament activist, Dr. Åsa Lindström. Åsa is an emergency medicine physician working at Skane University Hospital in Malmo, and she can correct me on those Swedish pronunciations. She's been involved in the work against nuclear weapons within IPPNW and the Swedish Physicians Against Nuclear Weapons for over 20 years. She joined as a medical student. Within this work, she was previously the chair of Swedish Physicians Against Nuclear Weapons and is currently the vice chair. So I'm going to pass the floor to Åsa now, and then we'll have time for questions and an open discussion. Åsa, please go ahead.
Thank you very much, Molly, and your Swedish pronunciation was really good. So I have a presentation that I will share with you. So start doing that. Okay. So I just have to adjust my screen. Okay. So I will talk about the medical response capacity to just a single nuclear detonation today. And now it's not working. Okay. Now it's working. Okay, so I will do this out of a study and a report that we has done in Sweden within Swedish Physicians Against Nuclear Weapons. Now this is in Swedish. However, you can find it at our webpage. And we did this study a couple of years ago in 2022, and we did the review last year and updated it. So I will go through a scenario, but first, just some repetition for most of you, at least I think. I will just take very short about what happens if a nuclear weapon is detonated. So there will be a powerful pressure wave that would crush people and buildings several kilometers away from the detonation site. And there will be injuries, mostly such as fractures, crushing injuries, and bleedings. And then we have the heat radiation that causes severe burns. and these high temperatures give severe fall thickness burns. And the burn injuries are the injuries that would kill most people in the case of a nuclear detonation. I think there was about 60% of the casualties in Hiroshima that was due to burn injuries. And then what's special with nuclear weapons is, of course, the radioactivity. And closest to explosion, it will be fatal. And there's also the longer term effects. The scenario that I will go through is a scenario of Stockholm, the capital of Sweden. And first, the scenario of the nuclear detonation. I think most of you have seen these kind of pictures before. This map is taken from Nuke Map. And this is a scenario with an air blast. And in the scenario, the detonation would be just above the central of Stockholm and where the Parliament of Sweden is situated. And it's 100 kiloton bomb in this scenario. It's quite a common bomb today's arsenal, however, quite a small bomb. So this is really not the worst case scenario. And this yellow circle first is about 400 meters of radio, and that's where the fireball would take place. That would wipe out about everything and make everything burn. And then at 1 kilometer radius, there will be a little dose of radiation. At a 3 kilometer radius, there will be this very high pressure wave that would crush people and buildings. And there will also be a huge fire spread from the radiation. And then at 4 kilometers radius, there will still be really intense heat that will cause severe burn injuries, but everything will start burn. There will be huge fires. And this outer circle, that's a little bit gray, is where there still will be a pressure wave that injures people, can injure buildings, and in this area there will still be severe burns. And this is a large part of Stockholm that is included in these areas that will be affected with only 100 kiloton bomb. Just some fact about Stockholm in this scenario. So the number of people living in Stockholm depends a little bit on how you calculate it, but within what's called Greater Stockholm, including suburbs, there are 2.4 million people living. There are 7 hospitals that are considered emergency hospitals that have an emergency department as well of all kind of specialities, intensive care units. There are several other hospitals that are smaller. Some have, in Stockholm is a little bit special. There are smaller hospitals that only have geriatric medical wards. However, those are functional medical wards. So when we looked into the capacity of the healthcare, we are counting them as well. There are small hospitals that have like surgeries for patients that are only staying during the day. And we are counting those beds as well. And in total, there are 4,000 beds in Stockholm. Of those, there are about 100 that are intensive care unit beds. And in Stockholm, we don't have any burn intensive care beds. We only have 2 centers in the entire Sweden with that highly specified care. And those are in Uppsala and Linköping, so it's outside of Stockholm. And the number of doctors that are employed within the Stockholm region is 11,400, and the nurses are 23,800. So that's some fact in this scenario. And what we looked into in this study is how what would the effect be after detonation with a 100-kiloton bomb. So this is a map of the hospitals in Stockholm. It's quite small. It's because, see if I can show you on the map, yes, because one of those hospitals that do have emergency department and all kind of different wards and intensive care is actually outside of Stockholm up here. And then the 5 others are more or less within Stockholm, and there's one south of Stockholm. It's those that are a dark red color, like this one, that are like the fully equipped hospitals. The other ones are the smaller hospitals or bigger primary care centers that have some kind of capacity for emergency primary care. So this is just a closer-up map. So the hospital that is north of Stockholm is not included here. So this area will be affected, which means that at least 3 of those hospitals and the biggest hospitals in Stockholm will more or less be wiped out in this scenario. Because as I guess everywhere else, the hospitals are in the city centers. So what I will do is go through what will the capacity of healthcare in Stockholm and what will happen in the event of a nuclear detonation. So 100-kiloton bomb. And these numbers of death and injured is also taken from Nuke Map. And it's calculated on how many people that could be in the center of Stockholm at any given time. So approximately 90,000 people were probably killed. And this is the immediate effects, so no long-term effects, so immediate deaths. And approximately 250,000 injured. And this is small bomb. And well, the need for hospital care will be for fractures, burns, penetrating injuries, radiation sickness, internal bleeding, and so on. And this would be injured people that need healthcare help in a few minutes. So in Stockholm, as I showed before, there are about 10,300 doctors, there would be 10,300 doctors and 21,400 nurses that would not be injured. And these are calculated numbers that at least 10% of the doctors would be killed or injured, so they could not work. In the reality, that number would probably be higher. So we have done a scenario, not showing the worst case scenario, to show that, like, even if you're counting low, how bad it would be. Probably 2,400 beds left. And out of those, maybe about 50 intensive care beds. So that would mean more than 100 patients per bed. And each surviving doctor will be responsible for 24 patients. And then, of course, you need to keep in mind that most of these beds are already occupied by patients. In Sweden, we have very low number of hospitals beds compared to many other countries. And at a normal day, 90 to 100% of our beds are occupied. So there will be no beds available for these new patients. And also keep in mind that when we count the doctors, it's any kind of doctor. Most of the people, the medical staff having the speciality needed to give emergency care, to give intensive care, they would be at those biggest hospital in the city center. So they would be injured and killed in great number than other doctors, nurses that are maybe working with our patients in primary care, psychiatry. So this is any doctors. And just to compare with entire Sweden, we have about 15,000 to 16,000 hospital beds in the entire Sweden. So even if we would use the entire country, and there would be 16 patients for each bed in this scenario. And in the entire Sweden, we have the capacity to care for 25 patients with severe burn injuries who are needing burn intensive care. So that shows how low the capacity is, even if everything is well functioning. And we also did a compare with the COVID pandemic, because there was also a lot of stress for the healthcare system. And during the period where we have the most patients treated in hospitals and intensive care, the most intense period, there were about almost 2,600 patients in hospital, and about 550 in intensive care. And during the COVID pandemic, we did almost double the number of intensive care unit beds. However, that took months, several months to do. And in a scenario of a nuclear detonation, this capacity will be needed in minutes. It's showing how far away the capacity to respond on something like this is. So, and also comparing with the COVID pandemic, the injuries in a scenario with a 100 kiloton nuclear detonation in Stockholm would mean 100 times as many who's needed to treat it than when we had during the most intensive period in Sweden with COVID patients. And that was a real stress for the healthcare system, for hospitals, for the people working. Also very short on the infrastructure. We haven't really looked into this in our study and in a report, but it's we have mentioned it in our report, and it's worth mentioning because all these numbers are in a case of hospitals working. Even those hospitals that would not be wiped out, they would probably not be full functional. And large part of the infrastructure will, of course, as well be destroyed. And in central Stockholm, and also a big part of Greater Stockholm, roads and bridges and so on would, of course, be destroyed, preventing any kind of medical response ambulances. It would also, of course, make it impossible for help outside to arrive. And then the radioactive fallout, we haven't taken that really into the report, but that would also, of course, complicate the entire situation. And then we have the electromagnetic pulse that would knock out electricity and communication. And everyone working in a hospital today knows how dependent we are on everything working with the electricity. So even the hospital not destroyed, not wiped out, will probably not function very well. So this is a summary of the medical response capacity, or it's more the incapacity. And I said 100 kiloton detonation in Stockholm, the capital of Sweden. This is a small bomb, so definitely not worst case scenario. And injured 250,000 people, probably, which would mean 24 injured per doctor and 100 injured per bed. And this is all kind of beds. It might be geriatric, medical, hospital, that will have beds left. So any kind of bed, any kind of doctor. And even with well-functioned hospital care, healthcare system, this would definitely not work, and it wouldn't function very well. So this is the summary of our study and our report. So the conclusion is, of course, that there are no country, no coalition, no organization that has the capacity or can build the capacity to handle the consequences. So the medical response is impossible. And this study is only a small piece, I think, to show that we are talking about in IPPNW at all time about the humanitarian consequences. Even in a scenario with a small bomb, counting with low numbers, definitely not the worst case scenario. We will be far away if we look to the numbers to be able to respond to this kind of disaster.